Good afternoon. Here's our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 543 new cases of COVID-19. This brings our statewide total to 57,154 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This includes 3,790 positive cases in healthcare workers and 11,801 positive cases among residents of 540 long-term care living facilities, which include nursing homes and personal care homes. Tragically, our statewide total of patients who have tested positive for COVID-19 that have passed away is now 3,731. And to date, all of the deaths have been in adult patients. So you all have heard that the governor and I have been talking about the importance of getting tested for COVID-19 if someone has symptoms. Getting tested helps us identify outbreaks. So it's essential that we have accessible and available testing sites in communities across Pennsylvania. I want to highlight the great work of Rite Aid, a local Pennsylvania company, and the great work that they are doing to help increase testing access to residents in Pennsylvania. Starting today, 9 new drive-through testing sites will be open to the public at Rite Aid locations across eastern Pennsylvania. Patients will be able to get tested for free at these sites. These new locations are in addition to the 6 testing sites that Rite Aid has already established across the state. If you would like to get tested at one of these sites, you can make an appointment by going to www.riteaid.com. A map with all of the testing locations in Pennsylvania can be found at our website at health.pa.gov. Also on our website, we have a symptoms and testing section that gives you tools to see if you should be tested, including a CDC symptom checklist tool. Symptoms of COVID-19 can include fever, cough, shortness of breath, but also diarrhea, chills or shaking chills, muscle pains, headache, sore throat, or a new loss of taste or smell. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Don't touch your face, especially after touching surfaces. And clean surfaces frequently. If you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you live in an area that has turned from red to yellow, please continue to practice social distancing when you are out in public. And make sure that you are wearing a mask to protect yourself and those around you. Remember, my mask protects you and your mask protects me. And if we're all wearing masks, then the community is protected. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you are struggling with addiction and need help during these unpredictable times, please call our Get Help hotline at 1-800-662-HELP or otherwise 1-800-662-4357. Again, 1-800-662-4357. For the most reliable information regarding Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from ABC 27. Is the state stepping up license inspections of nursing homes and personal care homes in the wake of the increased numbers of COVID deaths in those facilities?
Well, the Department of Health regulates nursing homes, and the Department of Human Services regulates personal care homes. And at the order of CMS, the Center for Medicare and Medicaid Services, we're not doing the routine inspections that are done every year by one of our departments for those facilities. But we certainly are continuing to investigate for any complaints or concerns regarding the care at those facilities, and we can do that either virtually or, if necessary, we can have our team go to the facility.
From WTAE, what is the role of the National Guard assigned to Brighton Rehab? Will the facility be evacuated, and will the management's handling of patients during the pandemic be investigated?
Well, today we have placed a temporary manager at Brighton that is being paid out of our civil monetary penalty funds from the Department of Health. That manager is Alair Health Systems of New Jersey and will remain in place. We are doing this at the agreement of all of the parties. The National Guard is there providing actually direct care support, and they'll be there from May 11th to May 18th. On May 18th, staff contracted by the owners of the facility will be on site to care for patients. So it's going to be direct patient care that the National Guard will be participating in.
And then the questions, will the facility be evacuated, and will the management's handling of patients during the pandemic be investigated?
Well, we do not have intentions to evacuate the facility. That's why we've put in the temporary manager who's arriving there today, as well as the National Guard. We'll take whatever means are necessary to protect the health and safety of the patients and the staff at the facility. So right now we're looking forward in terms of all of that work and making sure that the patients are taken care of.
From the Post-Gazette, the National Guard says Brighton Rehabilitation is the 9th nursing home it has provided this kind of support to. Why isn't it the first nursing home to get support, since it's long been the worst nursing home outbreak in the state?
Well, unfortunately, as we know, nursing homes and personal care homes, these long-term facilities, are some of the most challenged institutions in Pennsylvania and really throughout the nation. Looking at the responses in New York and New Jersey and Maryland and Illinois and Massachusetts and other states, this has really been one of the most challenging situation for all of us with COVID-19. And so there have been nursing homes that have had significant issues in terms of staffing throughout the state. And so the determination was that the National Guard had to be in other places and now is in Brighton.
As you know, the state statute, this is from the Post-Gazette, gives the state power to impose a manager. And the statute says that a manager can be imposed either when a health care provider has failed to bring the facility into compliance within the time specified by the department, or when the facility has demonstrated that it is unwilling or unable to achieve compliance, such as would convince a reasonable person that any correction of violations would be unlikely to be maintained. So which of these two options is the reason the state is imposing a temporary manager at Brighton?
So according to our legal experts and our legal team, those are imposed if the facility refuses to work with us in terms of the temporary manager. But as I said, the temporary manager is being instituted by agreement of all the parties, and that's how the temporary manager is starting at Brighton.
From Bucks County Courier-Times, Dr. Levine, given that New Jersey and New York are releasing facility-level data on long-term care infections and deaths, why has Pennsylvania refused, considering aggregate data does not violate privacy of residents? What is the value of not releasing this infection data to the public?
As I said last week, we were awaiting the CMS guidance about the data to be released. We have been working on that plan, and the data will be released later this week.
From the Philadelphia Inquirer, you've said that the Department of Health is continuing to discuss outbreaks in nursing homes, whether more information should be released publicly. Are those conversations ongoing, and will more information be released about specific homes with cases?
As I just stated, we'll be releasing that information by the end of the week.
From the Bucks County Courier-Times, What did Bucks County officials say to you on Saturday during your Skype meeting regarding reopening, and did it change your mind?
Well, we had a very good discussion with the county commissioners as well as the county health commissioner and others, with our staff and their staff, about Bucks County in terms of the number of cases and locations of cases. And we're going to be working with them as well as all the other counties in the southeast on a plan for what metrics we would be using and how we'd be looking at the southeast eventually going from red to yellow. We did not come to any specific conclusions, but did agree that we'll continue all of those discussions.
From WTAE, what advice do you have for child care centers in areas moving into the yellow phase this Friday?
So those are available on our frequently asked question document on our website, and also it is the Department of Human Services that determines those guidelines.
From Fox 29, please provide more details regarding your discussions with Philadelphia leadership and that of the southeastern PA counties regarding an opening plan tailored to their specific challenges.
As I just said, we've had discussions with Philadelphia and Montgomery and other counties. We've had discussions with Bucks County, and we're going to continue all of those discussions about the metrics that we would use and the data that we would use and all the other considerations that we would use for the southeast to go from red to yellow. Those conversations will be continuing this week.
From the Philadelphia Inquirer, what message do you have for counties that are defying Governor Wolf's orders and moving themselves into the yellow phase? How could their reopening affect neighboring counties?
So the governor had addressed that earlier. We are concerned about counties going from red to yellow before they're ready from a public health perspective, looking at all of the different data, because we want to make sure that we don't precipitate outbreaks of COVID-19.
From WTAE, do you have a response to State Senator Doug Mastriano, who today was at the Capitol in Harrisburg calling for your resignation?
I have no response for the senator. Of course, I serve at the behest of the governor, and the governor answered that question earlier.
From WKOK, any update in the criteria, in the specific criteria to send a yellow county into the green phase?
We have not determined what the exact criteria will be for counties to go from yellow to green. Of course, the first counties just went to yellow on Friday. We have, that was 24 counties. We have 13 more counties going to yellow this Friday. We're working on other criteria for counties to go from red to yellow. And as we're working on that, we'll start to think about what would be necessary to go from yellow to green.
From News Talk 104.1, do all Pennsylvania counties have to be in yellow before any county can move into green?
We haven't made any of those determinations to the present time.
From WKOK, are residents expected to help enforce the new rules in the yellow phase? If so, to whom should they direct their reporting? Police, 911, or the Department of Health?
Well, I would not call 911 unless there's an emergency. Certainly, if you have any type of emergency, call 911. I think that if there are concerns about businesses, then they can contact their local authorities. And I believe that there is a business line that people can either email or call that's on our website.
From Penn Live, your daily numbers include 2% of people hospitalized are ages 0 to 29. What are the ages of the youngest diagnosed cases and the youngest hospitalized patients?
I do not have that granular data at my fingertips. We'll have to check and get back to you.
From WBRE, at this morning's news conference, Governor Wolf said counties defying state orders would not receive discretionary funding from Pennsylvania. A short time ago, the governor tweeted that he would announce consequences for counties defying state orders. Will there be additional consequences beyond the loss of discretionary funding, and can you elaborate?
No, I'm going to leave that to the governor.
From Erie News Now, what are some of the health consequences for counties that move into the yellow phase before you and the governor say it's okay?
Well, so it's more than just the governor and I saying okay. We have really a quite expert team in terms of our epidemiologists and our public health officials looking at all of the data and different ways to depict the data, the trajectory animations that are actually available on our website and other. In addition, we have a number of different models that we're looking at that we've discussed, including the model panel from Carnegie Mellon University and others. We go over the public health impacts, and then we discuss things with the governor's office. Of course, there are social impacts, political impacts, and particularly economic impacts. So all of that has to be taken into consideration when we make our recommendations, and then the governor makes his decisions.
From Fox 43, Johns Hopkins University started enrollment today for an online training course to become a contact tracer. Since there is now a push for contact tracing in Pennsylvania, would you recommend people take this training course?
Well, there are a number of different training courses that are available, and I think the training courses are great. I don't have a specific preference for one or another. Johns Hopkins obviously is a fantastic university with a great public health school, so I'm sure it's excellent. I don't have any specific details about it. But I wouldn't recommend one course over any other course.
From Lehigh Valley Live, will the health department release hospitalization rates and discharges by county? How about revised daily death counts?
Well, we are working on all of our death data, and so I'll talk with our team about how granular we can get.
From Fox 43, some people in Pennsylvania who have taken a COVID antibody test have been told that if the results are positive, they would be given to the Department of Health and would be considered as a presumed COVID case. Is that true? And has there been reporting? Is that true? And has been the Department of Health reporting that number in its daily count, or will that be reported soon in a separate category?
We have been getting that data, and no, we're not reporting it in a separate or different count.
From the Altoona Mirror, if moving to a yellow causes infections, how long would it take for you to realize that, and how do you plan to monitor that situation?
So as we've been discussing, expanding testing in those areas, as well as our ability to do case investigations and contact tracing, and then responding to any outbreak with the patient being isolated and then the contacts being quarantined. Of course, the incubation period has to be taken into consideration. The incubation period ranges from 2 days to 14 days, with an average of 5 days. So for us to know, usually it would be at least 5 to 7 days if there's start to be increase of cases, and then possibly 2 weeks or more.
From the Scranton Times-Tribune, the Northeast region saw the fewest cases today that it has seen in at least 2 weeks. Does that suggest that community spread is slowing down in Northeast Pennsylvania? And does it open up the potential for the region to move into the yellow phase?
Well, it's a very positive finding, but again, one day's data is not as meaningful as trends in data, so we're going to be watching that very carefully. And of course, a trend in data with decreasing number of cases would be very positive, that we'll be taking into consideration as we consider all the variables for counties to go from red to yellow.
From the Capital Star, Rite Aid says it would provide testing to asymptomatic people in keeping with federal guidelines from the Department of Health and Human Services. Can you please clarify the role that the Pennsylvania Department of Health guidelines play in determining which residents in Pennsylvania get tests?
Well, we have been prioritizing the testing of symptomatic individuals, but I have no problems if Rite Aid tests asymptomatic individuals as well. Our priority is for symptomatic individuals, but as we announced today, they're going to be expanding their sites. Anyone can go and register to go get a free test, and so we want to be able to expand testing throughout Pennsylvania.
If Rite Aid can administer tests more widely, what's to stop other healthcare providers from rushing ahead of state guidelines to test asymptomatic patients?
Well, I don't have an objection if providers want to do that. Where we're going to be prioritizing our testing is in terms of symptomatic individuals, but we do want to get to the point where we're doing that type of population-based surveillance-type testing, and we're going to be continuing to work towards that.
And then could the Department of Health work with Rite Aid to direct their supply of tests to nursing homes, prisons, or other congregate settings that could benefit from universal testing?
We'll work with really all testing facilities, whether it's Rite Aid or hospitals or health systems or our own state lab, to certainly prioritize testing in nursing homes and personal care homes. From
the Tribune Review, New York has ordered testing of all nursing home staff twice per week. Does Pennsylvania have plans to issue a similar order?
We are working on those plans, and we plan to announce more information later this week.
From the Daily American, we were contacted by a reader with a question about negative tests. If a person receives several negative tests because they are given a test each time they go to a medical facility, are those counted as separate negative tests, or is each test counted as negative?
Each test would be counted as negative.
From the Capital Star, can you please describe in as much detail as possible what contact tracing currently looks like in yellow phase counties, including how many DOH personnel are conducting contact tracing, the capacity to test known contacts, and any plans to increase tracer capacity?
So we are absolutely working on plans to increase our capacity, but we're doing really well. I don't have granular detail about the specific numbers. We'll have to get back to you on that. But we have a whole program that's working on our contact tracing, and I think we're doing well.
From WGAL, the governor gave his reaction to counties moving from red to yellow without permission. What is your reaction to those counties defying the order?
I have no further comments beyond what the governor said.
From PBS 39, this is the fewest number of single-day new cases since March 28th. Is that promising, or is it a function of less intense reporting over the weekend?
Well, we'll see. We have noticed for weeks now, maybe months, that there tends to be decreased reporting on the weekend, especially if there's a holiday, and yesterday was Mother's Day. So we're going to have to see, as data comes in this week, if that's one day's reporting or if that's a trend. So we'll see.
From the Post-Gazette, why is the state paying for the temporary manager? Shouldn't Brighton pay that fee?
Usually when we put in a temporary manager that reports to us, then we pay the fee of the temporary manager. That's pretty routine.
From News Talk 104.1, why did the Lycoming County case numbers increase by 1 today, while the nursing home case count increased by 3? Is that a statistical reconciliation issue?
I'm not exactly sure in terms of that granularity of data. Of course, if someone is a resident of another state, then they or another county, they count towards that county, but I'm actually not specifically sure.
From the Borough newspaper, has the CMU model been completed, and will it be made public?
The CMU model is public. It's available on our website, and it's not one completion. Actually, they update it every week, and that's available actually at our website at health.pa.gov.
From WKOK, can you list some of the variables factored into the red, yellow, green phases? For example, have you factored in that there will be some people who are non-compliant, and there will be some other high-risk behaviors?
Yes. So the models that we look at do factor in behavior in terms of their compliance with the stay-at-home recommendations for red counties and masking, etc. And so the universities that are doing the modeling do factor that behavior into their models.
From News Talk 104.1, with 65% of COVID-19 deaths in Pennsylvania occurring in nursing or personal care homes, going forward, what measures are you taking to ensure the well-being of those patients and healthcare workers?
So I have said before that actually the well-being and the safety and the health of individuals in long-term care living facilities, such as nursing home and personal care homes, are really our top priority. And so we have a collaboration between the Pennsylvania Department of Health as well as PEMA, and as well as working with the facilities themselves in terms of working towards that. We have infection control experts and public health experts at the Department of Health that have been working with those facilities. We have been working with 100% of the facilities that have had cases of COVID-19. In addition, we have contracted with ECRI, our consultants, to do further infection control work with those facilities. In addition, as we've been discussing, we have had the National Guard go in to provide staffing for those facilities. We have pushed out well over 50 1,500 different specific pushes to all the nursing homes for personal protective equipment, such as N95 masks and the other type of resources that they need to take care of patients, and we will be continuing to do that. Over the last number of weeks, actually, since hospitals have been doing somewhat better, our absolute priority has been pushing out the PPE towards that. We're going to be working on the, and as I've said before, the release of the specific data regarding nursing homes and cases later this week. And so we will continue to do absolutely everything we can to protect the staff and the residents of long-term care living facilities.
From Fox 43, a follow-up question. Can you elaborate as to why you are not reporting antibody test results?
We are reporting antibody test results. We're not reporting it separately than any other results.
Those are all the questions that have been submitted for today's press conference. Our next briefing will be tomorrow. Thank you.